Hi there. My name is Will Brown and I'm president of Austin Medical Products. We manufacture the AMPatch Stoma cover. We've been doing this for over 30 years now, and to our knowledge we are the only company devoted 100% of its resources to manufacturing a stoma cover for people that have a continent intestinal reservoir. Our intent today is not to sell you anything, but to teach you more about the AMPatch and what it is used for. At the end of the video, we'll provide you with our address and telephone number in the event that you would like more information about our product. Thank you.
Hi, I'm Crystal. As you may know, there are several types of surgical procedures that can be performed when a person is faced with ostomy surgery. The type of surgery depends on many different factors. Some of the procedures that the AMPatch can be used with are colostomies, mucus or draining fistulas, ACE or MACE stomas, and continent intestinal reservoirs, like the Indiana, Koch, and BCIR pouches. Later, we will demonstrate the application of the AMPatch with someone who has a BCIR pouch stoma. With all of these procedures, the individual is left with a stoma, or an opening, that is at times inactive with regards to discharge. But because the stoma is a mucous membrane, it constantly secretes mucus at the surface. Some people secrete a lot of mucus, while others secrete very little, if any. In all of these situations, the individual generally has a need or desire to keep the mucus from wetting their clothing and to have a dressing to cover and protect the stoma. Many people use the AMPatch to meet this need. We currently produce about 500 different styles of the AMPatch, with many customizations in size, shape, and absorbency. Most people use a standard variety, such as the G3, while we produce many custom styles. Why so many custom styles? Because people and stomas come in all shapes and sizes. We can customize the location of the hole on the patch, the size of the hole, use different types of tape, and use different absorbent mediums. So now that you have an idea of what the AMPatch is and what it's for, we have a demonstration for you. This demo is graphic and is performed by our consultant, Christopher, who has a BCIR, a Barnett Continent Intestinal Reservoir. Chris will now show you how to apply and remove the AMPatch.
Hi, I'm Christopher. I'm going to be showing you just how easy it is to remove and apply the AMPatch. But first, let me tell you a little about myself. In 1979, I was diagnosed with ulcerative colitis. I had my colon removed and I was given a conventional Brook ileostomy. I wore an external appliance from 1979 to 1985. In 1985, I had an internal pouch constructed. Mine is known as a BCIR pouch, and I've had that for about 30 years now. What I'm going to do is remove my existing patch. I'll clean the skin up around the stoma like I normally do, and then apply a new patch to the skin. So here we go. Now, when removing adhesive tapes from the skin, it's generally recommended that you start in one corner and push the skin away from the tape. This minimizes the trauma to the skin. Some people will experience a little bit of discomfort when doing this because the tape does pull on the skin a bit. But most people get used to it over time, or it simply doesn't hurt anymore because the skin around the stoma will thicken like mine has. Once the patch is removed, I would normally intubate my pouch with a catheter. When done, if I haven't soiled the skin very much, I'll just clean the stoma up with a little bit of dry tissue paper. If I have a bit more soiling, I'll use a damp washcloth to gently clean around the skin, being sure to let the skin get good and dry before I put a new patch on. This is the skin side of the AMPatch. What you want to do first is remove this portion, exposing the absorbent material inside the AMPatch. Next, you want to remove the large piece of paper backing, which exposes the majority of the adhesive on the AMPatch. The thin strip of paper backing remaining allows you to handle the patch while you locate it over your stoma. Now, what you want to do is line the patch up, centering the hole over the stoma, and then press the patch firmly in place. And then lastly, you just have to remove that thin strip of paper backing and press that portion of the patch firmly in place. And there you have it, it's that simple. I will generally wear this patch until I have to empty my internal pouch again. For me, that's about every 6 to 8 hours. Now, if you have a colostomy, fistula, or some other type of stoma, your wear time may be a bit different, depending on the amount of output from your stoma and the size patch you choose. You generally need to put a new patch on each time because, as you know, adhesive loses its strength when it is removed from the skin. If you've ever tried to re-stick a Band-Aid over a wound, you know that it doesn't adhere very well the second time. Now, you may want to use a bit of mild soap to clean the skin around the stoma. If so, you just need to keep in mind that any soap residues left behind can interfere with the adhesion of the patch. So you want to thoroughly remove all soap residues. You might have noticed that the hair around my stoma was shaved. If you tend to have a lot of hair in the area of your stoma, you're going to probably need to shave it, as hair underneath the patch can also interfere with its adhesion. Now, the AMPatch will stick fine to scar tissue, but the scar tissue will be a bit more sensitive immediately following surgery. It will become more like your normal skin over time, though. You might have also noticed that the area around my stoma is fairly flat. If you tend to have a few more creases or folds in the skin around your stoma, you want to try to flatten that skin out with one hand while applying the AMPatch, being sure to press the patch into any uneven areas of the skin. And finally, if you want to go in the water with the AMPatch, we recommend that you apply the patch at least 20 to 30 minutes before going in the water. This will allow the adhesive to reach its full strength. Now, if you would like some samples of the AMPatch or have any questions on the product, there'll be information to contact me at the end of the video.
And there you have it. Simple, effective, and easy to use. I hope you've been able to garner something from this presentation. If you think that you may be able to use the AMPatch, you can call Chris at 866-217-3857. And he will try to help you determine what type of AMPatch would be most suitable for your needs. Thank you for watching.